guys, bear with me. I am taking time to give some information to the newbie nurses, especially about documentation. So I was going through the internet, doing some things at work, and then came across the story, and it's talking about a former U.S. representative named Eddie Bernice Johnson. Apparently how her family is suing the Baylor hospital system for being negligent in terms of the care that they provided to this patient, and subsequently, unfortunately, she succumbed to the injuries or the lack of care that was provided for her. So I'm gonna do a signature series on this, especially for my newbie nurses who are coming in. Again, you may not have gotten this in orientation, you may not have gotten this from your preceptor, but I'm your favorite RN mentor and coach, and I'm here to help you, especially when it comes to documenting. A lot of times we just document really willy-nilly. Nursing school doesn't teach you how to document, and unless you have a situation like this where you really have to look up the information yourself, you may not be aware of what negligence is even what's even considered negligence when it comes to your license. So I'm going to go ahead and do a mini series, a signature series, and tell you more about this. But every nurse needs to know that there are 4 elements required to prove negligence in nursing, right? And so that has to do with number 1 being the duty of care. The nurse has the responsibility to practice within their scope. And then examples of this include administering medications, monitoring the patient for changes, alerting the physicians whenever there's a change in the patient's status, okay? There's also a breach of duty. In order to prove negligence in nursing, it is necessary to articulate the nurse's duty and demonstrate how the nurse deviated from that duty. There must be a clear expectation of duty before a breach of duty can occur. For example, if a nurse observes that a patient is declining in their status and does not report that change to an attending physician, then the nurse has committed a breach of duty with regards to reporting. Then there also has to be the burden of proof for causation. This 3rd element of negligence in nursing is causation. Causation requires a complainant to show proof that the nurse's breach of duty was the cause of the injury or the loss or death to a patient. For example, a nurse failed to document a previous dose of a medication, and then someone else went ahead and documented the same medication, and then the patient had injuries or death from that, right? That is proof of causation. And then lastly, there has to be some damages. Complainants must prove that injuries or damages occurred as a result of the breach of duty by the nurse. Considering the example above, the damage could be that the patient suffers respiratory arrest or death due to the depressant properties of the opioids, right? So again, you may not be aware of this, but this is what we're held to, right? Whenever we get a job, whenever we take the oath, this is within our scope of practice. So the metrics that we're going to be measured against is our duty to care, if there's a breach in duty, if there's a causation, and then lastly, if there's any damages. And if you read further in the story, it's really kind of sad. It says how the Eddie Bernice Johnson, she was a U.S. representative, and most recently, I think in January of 2023, she had retired, and then sometime in like mid-October, she ended up getting lumbar surgery, and then she had an infection of the site. The family members report in their story that the patient had called, her one son in particular reports that the patient had called him and said that she was laying in poop and she had not been cleaned. And then in the reports, it said he got to her within about 10 minutes. And then he went and told the director of nursing or the manager of some sort what had happened. And by the time the director of nursing and the family member had gotten back in the room, the staff was cleaning up the patient. Now, here is the other bummer, right? Especially for the nurse or the nurses who are involved in this case. It later goes to state that within a few days after that said incident, they did a culture of the wound, and the wound had bacteria that contained fecal matter in there, and the wound was like had a lot of drainage and purulent drainage, and then they did the culture, and then it came back that she had stool contaminants in the wound. And subsequently, it doesn't really go into much more detail about her healing process, but that, you know, she succumbed to those things, right? She succumbed to the like wound dehiscence, I presume, and possible sepsis. But again, it's super important because unfortunately, if the nurse did not document, you know, that the time frame in which they went to clean up the patient, or if they turned and repositioned her, you know, and the fact that they cleaned the wound, if they didn't document any wound cleaning or cleaning the site with chlorhexidine or cleaning the site with soap and water, unfortunately, if this goes to litigation, it's going to be a lot of information to go through if the nurse didn't document. So this is why I find it really interesting for me to teach you guys how to document. Again, it's not something that you learn in nursing school, and your preceptor may not have been, you know, provided a lot of information for you, but I'm here as best I can as I'm researching and learning this. I'm teaching you what I am finding out, and I'm teaching you what you should be doing, things that I've done, but I'm teaching you how to not get caught up with regards to your documentation with regards to negligence. So like and follow for more. I'm going to do a series on this. Comment below if this is something that you want to hear about. But either way, I'm going to teach it to you because this is a matter of your livelihood and then for a patient's life or death. Like and follow for more.